Okay, I'm down.
Susan Kang, welcome. Thank you so much for joining. Susan is an associate professor of political science at John Jay College, a member of the Executive Council of the Professional Staff Congress, CUNY, Faculty and Professional Staff Union at CUNY, member of the NYC Democratic Socialists of America, and she's joining us to speak out against a Medicare, quote unquote, reform for public sector worker retirees that's being pushed by NYC Mayor Eric Adams as a cost-saving measure. But tell us why it's not something that should be embraced, Susan.
Okay, so just a little bit of background.
Yeah.
Back under the de Blasio administration, at one point, de Blasio administration's like, oh, hey, do you want like back pay and like increases for your workers? 'Cause if so, we'll have to find cost-saving measures by taking away from the money that we would give to retirees. And not naming names, but people were like, oh, sure, let's do it. So
name
municipal
names.
So I think that this included like the UFT, for example. But I'm not here to criticize unions, because I think union leadership is making the best possible choices that they think they can. Right.
Okay.
So, right now we're kind of in a moment of like rock and hard place. And I think union leadership is trying to do what they can, given sort of the parameters that city government is offering to them, which, the parameters are not like things that I would agree with. So another little bit of background. Our mayor, who, he might have a lot of swagger, but he's not really all that great at, managing city budgets. So currently, I know that there is a $4.9 billion surplus budget. In addition to that, our city is bringing in more in tax revenues than projected. So all the austerity you hear about, when you hear about like, $15, $30 million cuts to things like our libraries, our millions of dollars in the cuts to our school system. A lot of this austerity is imposed. Like it's ideological. It's not like a budget balance sheet thing, no matter what anybody tells you. Okay, so there's money out there, but there's this need to find like, I believe the number is $600 million cost savings. So the idea is that Mayor Adams has actually started with de Blasio. It's been a couple of years now, but Mayor Adams has sort of run with this football that we're going to balance budgets on the backs of our retirees who are public sector workers. And public sector workers, which I am one, so I've been at CUNY for 15 years now. So I'm a mid-career professional. We often get paid less than our private sector counterparts. And part of the reason for that is that we get things like pensions. So I'm a pension haver. Nice. So don't be too jealous. And part of our pensions include things like a continuation of the same kinds of medical care that we've had as active service members. And right now, so maybe you saw this in the New York Times, but the Biden administration is actually cutting back on Medicare Advantage plans because we know that they defraud the government, right? They don't provide care, and they're often just like full of it. But anyway, at this exact moment, Mayor Adams is trying to push about 250,000 retirees. So municipal retirees, like people like, if you're a conservative, you should be mad because these are like our first responders, right? Like our firefighters, our EMTs, people who do sanitation, like social service workers, teachers. They're being pushed onto Medicare Advantage plans with no choices, right? No ability to stay on the traditional Medicare plan. And so I'm no expert on health economics or health policy, but I'm a rank and file member of my union. And traditional Medicare is like, that's what we all want, right? When we talk about Medicare for all, we talk about, people who take Medicare, they're providing you care and it's at a reasonable price. The prices are negotiated by Medicare and the costs are all provided and covered by the government, right? So it's not for profit. And Medicare Advantage is kind of like a Jedi mind trick, right? The idea is it sounds like Medicare, so it must be better than Medicare because it's an advantage. But in fact, Medicare Advantage is not Medicare. It's like a way to trick seniors, kind of like, those spam where they say, oh, click this link. Right. It's like a click this link for seniors where they say, oh, it's just like Medicare, but in fact, it's a for-profit driven enterprise. Okay, so to back up a little bit more, initially there was a proposal to move towards a Medicare Advantage plan to force all city retirees onto this plan. But some unions fought back. Now, some unions agreed because they said that, we do need to participate in a cost-saving measure, but about 26 unions, including the PSC, the Professional Staff Congress, which I'm a part of, they voted against it. And So this is sort of like an interesting thing because there's a split within the sort of the Municipal Labor Council, which is sort of this central body of city. I'm sorry, my cat is really loud, and if I brought
it's
him
your
in here, he'd be
cat?
louder.
I thought
Yeah,
your kids
sorry.
were playing a
No,
game. Okay.
no, my kids are really much more quiet and less loud. Okay, so 26 municipal unions, including the PSC, they were like, no, we're not going to accept this. So even though a lot of the big unions did go along with it, what matters was that there's also independent organizing happening from retirees. And so the PSC, we mobilized, we got our members, we mobilized with other retirees to like start bugging our city council members and saying, we can't accept Mayor Adams's plan to like push these punitive Medicare Advantage plans that are for profit. They make their money by denying care, right? It's so mind-boggling. I'm also like, in addition to being a DSA member and a union member, I'm also a scholar of human rights. So it really sort of, when you add that profit to the right, which is healthcare, it really does destroy it. So they make their money by denying care. So could you imagine if you're a retiree and you need a procedure, but you have to go through this like managed organization that's saying, I don't think you really need that scan or that, treatment or that chemo, right? So they're making decisions, bureaucrats who are responding to not stakeholders, to shareholders to make decisions about your healthcare, not doctors. So basically, because of this resistance, this organized response which include the PSC and other unions, we've been able to stop this from happening. But now we're sort of at a pivotal moment where there is something called an option C. And option C is something that Mayor Adams could allow, which would basically make all the municipal retirees and their families, give them default to participating in this Aetna-run Medicare Advantage plan. But then it would allow for retirees to opt out, right? To participate in that traditional Medicare program that, people fought for, that people delayed and deferred their compensation and other benefits for because they were expecting that when they retired. And that's, when you and I, the Bernie folks, when we talk about Medicare for All, that's sort of the model that we're thinking of. And so this would basically still allow for cost savings to about $33 million worth of cost savings. And there's still plenty of money that the city has in its like budget surplus to cover the shortfalls. And there's all sorts of ways that the city could engage in cost savings, right? So again, I'm not a health economist, but based on what I've seen, a lot of these costs come from hospital costs, and hospital costs for like the same procedures, they vary wildly. And so,
it's always presented, austerity is always presented as something that's not ideological and it's just a pragmatic thing. But we all know that that's not true. All of these things are choices and framing and decisions.
All these things
policy choices.
They're the result of very particular and specific political decisions about whose interests matter and whose interests don't, right? And like, there's all these problems with medical care in this country, which we can't get into right now. But like, there's no reason that we should just let hospitals decide by themselves what procedures should cost, right? Like that's not something that happens in other countries. Your previous guest, John Pilger, was talking about privatization of NHS. Well, this is a universal fight. It's not, even though it seems like I'm talking about something very specific to New York public sector retirees, it's actually a broader fight because this is happening across the country. This is happening in other states. And it's happening under a variety of Democratic and Republican leaderships at municipal, state, county levels.
And as HHHEE writes, Ralph Nader's podcast talks in depth about the Medicare Advantage, which he calls Medicare disadvantage. You guys may want to use that.
It's the best term, right? I mean, we do use the term Medicare disadvantage, right? But the thing is that it's a little bit difficult to get, we'll call them active members, to think about this in the long term, because one of the things that the retirees, activists tell me is that we're all future retirees, right? If we're lucky. And we'll need healthcare the most at that end part of our life, right? Like, so I read somewhere once that we're most expensive like the year before we die. And I've had 2 kids, right? So our medical care costs increase as we get older. And like our ability to get certain kinds of care will affect our quality of life. And public sector workers, right? If this sort of is allowed to happen carte blanche, then we'll see like Medicare itself starting to slip away. And like, there's very few things that make up the US safety net. right? Social Security, Medicare, Medicaid, unemployment, and like to allow what little we have, this very like hole-filled hammock of a social safety net to just like continue to tatter away will just leave Americans more and more vulnerable. And so if we think about it, like every stage of life is just increasingly challenging for people. Like I'm a parent, like I'm not in like childcare stage anymore, but like summer camp expensive, after school's expensive. I'm not even thinking about college costs, right? But college costs are through the roof. And then when they're done, housing costs are ridiculous, right? And then I got to worry about like, maybe I'll die because I won't be allowed to have a medical procedure that would save my life, you know, I don't know, in 30, 40 years. So we see how inhumane this is. Anyway, I don't want to be just a downer because it's really easy to be a downer. But, you know, if your listeners are interested in being part of this struggle, there's lots of things you can do, particularly if you're New York City based. Or not, you know, you can always mean tweet Eric Adams.
Yeah.
I'm pro this. Okay?
Yeah, everyone loves to mean tweet Eric Adams.
Yeah, that's what Twitter exists, right? Not for unnecessary takes. It's to mean tweet powerful people. Okay, so you can send a letter to the mayor, the OLR commissioner, and the city council. So if you've got a city council representative, then write to them. Or if you're in the metro area, you know, and you might be someone with a relationship to municipal city workers, or if you're someone who just likes, you know, public servants. And we have a link on our website, which is psc-cuny.com. And you can find like sort of little action letters. So we do it all for you, right? You don't have to do too much work on your own. We also have, if you are in New York City or if you like to yell at City Hall, which I 10 out of 10 recommend, we'll have a rally this Friday at noon in front of City Hall, which I believe is 250 Broadway. On the Murray Street Broadway area to protest this, right? Because this is not just about 250,000 retirees. It's about everybody's healthcare. And if you're not active in your union, get active. And if you're not in a union, organize one. And
what date is that? I just want to, in case people watch this, I don't want them to turn up if they're watching this later. What date is Friday?
I think it is, sorry, now I got to check my phone.
Okay.
31st.
Yeah, so, okay, March 31st is the protest.
Right, because the mayor has until April 1st.
Wow.
To make a decision about whether he'll allow this option C to happen, which will allow public sector retirees to opt out of Medicare Advantage and keep their traditional Medicare. Like, I hate that we have to even use like a descriptor. Like, it should just be there's Medicare and then everything else.
Right, Medicare and not Medicare, right.
Right. So, yeah, but Medicare is like trusted. So that's why they're able to sort of use this term to like trick people.
Right. Well, thank you, Susan. Anything else you want to mention?
Okay. This is very embarrassing, but I have started a podcast with another person in DSA. So it's not as great as your show. We're like on a different level, but it's Left on Red. And you can find us on Spreaker and everywhere else that you see podcasts. And it's just two organizers based out of Queens talking about organizing and news and fun stuff too, like lifting weights.
Oh, great.
Yeah.
Oh, I gotta lift some weight.
It's good to see you, Katie.
You too.
All right. Thanks for having me. Bye.
Bye, Susan.